Rahmatullahi wa barakatuh. Actually, I just want to tell you how to use this link. So if you will click here, you will find here articles which are topic wise, and you can see all the topics here. If you want to search any topic, you can write in the search and you will find it. Otherwise, you just have a look once and you will understand how I have arranged them. Okay. So for if you find more than one article for the same topic, you can just choose the most relevant one, or you can just have a look, because every article has different style in some way, and you can find the best out of it. So this is for the articles. Here I have made these four sources arrange in year wise. Okay, so like for example, anesthesia tutorial of the week all the way from 2005 to up to 2024, and maybe some more articles have come which I have not uploaded. I keep them updated. Okay, so updates in anesthesia and BJ education you will find here. After that, you will open here and you will find here few things. In here I have made all the topics arranged in like, not all the topics are being made, but you can just get a feel of a number of topics, that what you need to know. Okay, there are some short answer questions. This is also a very good way to understand and learn. Okay, because in that way you can know that from one topic which question can be asked. So just have a look and you will find a lot of important things. No, don't be confined for the people who are only having SAQs pattern. Even the people who are preparing for oral part or who are preparing for MCQs, they should have a look here, because if you know the topic, you will be able to answer in a better way. Okay, this is one thing. Then here you will find all the books: basic sciences review books, clinical sciences review books, ICU books, MCQ books. If you will click here, you will find different variety of MCQs: basic sciences, best choice questions like American style, clinical sciences MCQs, some FRC MCQs pool, ICU MCQs. Okay, some prometric MCQs, regional anesthesia MCQs. So this is just like a library for you. Then you will find a lot of books, which whenever I find any good book, I just put them here. There are some OSCE books. Okay, pain books, physics equipment book. So if someone wants to have MCQ, this physics equipment book, these are the best sources, and you will use them like a, because in some books some topic will be good, in the other book maybe some other topic will be good. Okay, so these are SAQs books. I know that people who don't have SAQs pattern, they are not attracted by this, but anyone who is in Pakistan or anywhere who wants to appear in FRCA or FCAI, they should have a look here, because if one nice morning you are appearing in that exam, you will not feel yourself totally unfamiliar. So, and another thing is that if you open them, you will learn a lot. There will be so many good things, like this is constructive response question. So just have a look here. Okay, so these are, and here there are so many so-called, I use the word so-called textbooks: Stolting and Morgan and Miller and everything you will find here. Okay, if anything missing, you can tell, and if we have, someone of us can share it again. Okay, so this is about books. How to study, I have made some, there are some examination videos. This is mainly for our fellowship exam, or if you just want to learn how to examine a patient, how to take history, you will find some video. How to approach patient, actually, in which I have made some journal things, and these are very important. Anesthesia plan, how to plan anesthesia, how to make any patient prepared. Okay, so there are surgical concerns, there are anesthesia related concerns, like these are, I have just chalked down the main thing which may be required to take history examination. Okay, and create the anesthesia risk. Okay, so you will just have a look and you will just find and if you understand this thing, you can put all your patients in this format. Okay, like in every patient you will find some risk assessment and certification, any optimization needed, any anticipation of complications, planning of all anesthesia steps like induction, maintenance, monitoring, recovery, fluid, positioning. So everything you will have. So I have just made compile them. Okay, and for example, we'll reference to surgery, why the surgery is occurring, how urgent it is, what is the surgical risk. So you can just have a look here. Okay, then some point about preoperative testing. I have made a just like you can say possible surgery list, and not all the surgeries you will be required to know details, but you can just chalk out. If you are talking about abdominal surgery, I have tried to chalk out as much as possible. Majority things will be common, but still you should know why the surgery is being occurring. What are the risks involved, what is the reason for that specific surgery. Okay, so you can just have a find important thing which can help you. Okay, and this is just a 1 for 50 topics list. So in this again, this is actually for Viva, and even the people who are going for different exams, I have made EDAIC pool also is there, and also for Saudi Commission for Health Specialty Viva pool. But the thing is that it's just matter for practice. So you can open any one of them and you can have a very good understanding of the topic. Okay, and it will help you a lot. So the purpose of compiling all this is that not only for Viva. Don't think that it is for Viva. It is preparing for your for your any exam, even MCQs, because unfortunately the people who are having any only MCQs style, they think that MCQs is different and Viva is different and written is different. No, knowledge is the same. Okay, if you know something, you can write. If you know something, you can speak out, and if you know something, only then you will be able to identify the answer. You can guess in few questions, not in all questions, and your knowledge will be patchy if you only try to learn and cram the answers to certain MCQs. I'm afraid you will have a very terrible concepts and you will definitely fail in the exam. So if you want to understand, you should prepare for written and oral part at the same time when you are preparing for MCQs. Thank you very much.